Chapter 9, Mental Health Assessment Skills. Chapter Learning Objectives. The mental health treatment plan serves multiple purposes. It is a guide for planning and implementing client care. The plan also serves as a way to monitor the client progress as well as therapeutic interventions. And the mental health treatment plan is a means for communicating and coordinating the client care. The physician provides information regarding the client's physical state as well as the need for medications. The social worker assesses the client's family, their work, and social interactions. The dietitian learns about the client's nutritional status. The psychiatrist and the psychologist explore the client's emotional and cognitive or knowledge functioning. The nurse assesses how the illness or disability affects the activities of daily living. And there are other care providers that will contribute various information through their own observations and interactions. Team members will meet to compare data, identify problems, and develop a treatment approach. Usually the medical treatments or medications are all combined with psychotherapy, behavioral therapy, and other therapeutic interventions. The overall treatment plan is developed for the individual client. The therapeutic actions or interventions are implemented, and the client's progress toward each goal is evaluated. This all uses the nursing process or ADPI. The mental health treatment plan is a guide for planning and implementing client care. As nurses, we are guided by the treatment plan as we develop specific nursing care plans. The clients will meet with treatment members to discuss their problems and attempt to meet their goals. The actual therapeutic interventions are evaluated, and the treatment plan is revised continuously to make sure that it is up to date. The plan will prevent costly duplication of services and provide a focus for all of the therapies, no matter what the specialty. This will increase the effectiveness of all the team. The mental health treatment plan is dynamic and changing with the patient and their progress. Using the treatment plan allows the patient and the provider to work together to meet the goals. One of the tools used in the diagnosis is the World Health Organization's Disability Assessment Tool. It is also known as HUDA's 2.0. The diagnosis of mental health problems remains the responsibility of the provider or the physician. However, nurses and other providers need to be familiarized with the multi-axis system of the psychiatric assessment. The nursing process is an organized framework. It is used for effective care and consists of the 5 steps of ADPI. Using this nursing process encourages nurses to focus on the client, and it helps develop appropriate and effective care. Assessment for a nurse includes gathering, verifying, and communicating information that is relative to the client. The holistic assessment includes gathering information about physical, intellectual, emotional, social, cultural, as well as spiritual aspects of each and every client. The more complete the picture, the more effective the treatment will be. Data or information relating to the actual client is grouped into objective and subjective. Objective data is information that can be measured and shared and gathered through the nurse's senses of sight, smell, touch, and hearing. Subjective data relate to the actual client's perceptions. It includes information that is abstract and difficult to measure or share. Data collection is a variety of activities. This is designed to gather information. The methods used for data collection may be interviews, observation, and rating scales. The holistic assessment for people that work with mentally or emotionally troubled individuals is the same as in any type of setting. However, in psychiatric treatment, the emphasis is on mental emotional functioning. The psychiatric assessment tool focuses on obtaining information about the client problems, coping behaviors, and their resources. A risk factor assessment helps formulate a nursing diagnosis that is based on any identification of risk. This would potentially present an immediate threat to the patient or others within the vicinity. When this assessment is used for risk factors, we look at suicide or self-harm, whether it's current or past. We look at alcohol and drug use, thinking about frequency and amount. Does it interfere with activities of daily living? We look at violence, current feelings, history of assault, destructive behaviors. We look at elopement, whether the client has left against medical advice. We look at seizures. Is there a history of seizures or falls? For diagnosis, the data are organized into related areas or clusters, and the problems are identified. Each problem is examined in great detail, and statements and nursing diagnoses are developed. The diagnoses and the interventions for nursing focus on how the client's problem affects their ability to carry out their activities of daily living. Client needs are also considered when the problem statement is being developed. The planning phase, this is when short-term and long-term goals are determined. The outcome of a problem is projected by identifying behaviors that would indicate that a problem is resolved. The expected outcomes are then used to monitor the progress of the client. The therapeutic actions or the interventions are planned using the goal and the expected outcomes. The intervention includes the actual delivery of all of the planned actions. Therapeutic interventions help guide clients toward their goals. The client response to each intervention is monitored. As medical professionals, we work to keep an open mind when we observe the client's response to the care, and we remember that many reactions are also culturally determined. The evaluation step will determine the effectiveness of the care provided. As a nurse, we compare the expected outcome with the actual outcome or results. We will note what actions, whether or not the goals were met, and which did not meet the goals. The actions that did not meet the goals are reassessed, and then the process is started again. Evaluation of both the client's and the caregiver's actions allows for adjustment in the dynamic process that is known as a treatment. The use of the nursing process requires knowledge, experience, and the practice of good judgment and clinical reasoning. Assessment with clients is something that is ongoing. It begins upon the admission to the facility and only ends after the relationship with the healthcare system is terminated. Objective data can be blood pressure, pulse, lab values, and these are all compared with the standard or normal results. Subjective will include information that is abstract, sometimes difficult to measure. The experiences of pain, nausea, and anxiety is not something that anyone can measure, but it is very individualized. Emotional and mental states are all subjective and difficult to measure. It is important to document all the subjective data as descriptively and accurately as possible. As a nurse, we do not want to include any judgmental statements. We document the facts, the reactions, and the behaviors in exact terms. We want to make sure that we place the client's words in quotation marks to show that they are exactly subjective data. Information gathered from formal interviews is routinely documented on a standardized form. An interview is an excellent way for obtaining information, and it begins a starting point for the therapeutic nurse-patient relationship. When using observation to gather data, nurses must remain objective. Any personal bias or attitudes need to be left outside the building because they can alter the nurse's perception and affect their objectivity. The holistic assessment is the same that is used in all medical settings. The psychiatric assessment tool focuses on obtaining information about problems, coping behaviors, and resources. There is a risk factor assessment tool that is required for clients that may pose a risk for violence either toward themselves or others. Reacting to a client's personal appearance or behaviors can stereotype them, and it can have a negative impact on the effectiveness of the therapeutic nurse-patient relationship. As nurses, we need to discover what each event means to the client and how they view the situation. As a nurse, we need to learn about their culture if we want to understand their point of view. When we have a client from an unfamiliar culture, the nurse should research information about the culture and the religious practices before doing the client interview. As nurses, if we're observant, we can learn a lot from our clients. We want to pay attention when certain subjects are avoided or passed over during the interview. These types of behaviors can be clues that there's a need for further investigation. We also observe methods of self-expression to help the nurse focus on the actual client's unspoken signals and the messages they communicate. Knowing the purpose of the interview, the assessment interview is not random. It is a purposefully planned interaction. As a nurse, we use self-awareness to signal when we are becoming too emotionally involved. A nurse may identify with certain individuals that have similar interests or situations. Using self-awareness allows the nurse to understand the emotional responses that are generated by some individuals. A sociocultural assessment focuses on 6 areas. Individuals are asked questions related to age, ethnicity or culture, gender, their level of education, their income status, as well as their belief system. When we look at our clients' general health care, we ask how often they go and see a regular health care provider. We want to know their last medical examination. We ask about family history, any diagnosed brain issues, any recent or past head traumas, any endocrine possible disturbances, thinking about the thyroid and adrenal function, their lifestyle. We look at their eating habits. We think about the medications that they take, any substance use, any potential exposure to toxins. We consider their occupation. We look at a history of cancer, lung problems, cardiac problems, blood diseases. We want to know if they have posed a risk for injury, thinking about sexual practices, sports, and we also want to make sure that we're looking at their presenting symptoms as well as coping responses. We want to make sure that when we document these, we're very descriptive. We document the nature, the frequency, and the intensity. And we look at the threats of safety to the individual or potentially others. To get an overall view of the actual client, it is concerning that we look at their current mental and emotional state using a mental status exam. Diagnostic studies for patients with mental emotional problems can include standard blood and urine tests, evaluation of electrolytes, and hormone function exams. Patients will also be screened for tuberculosis, HIV, and sexually transmitted diseases. The mental health status examination looks at the individual's general description, looking at appearance, speech, interaction during the interview, considers their emotional state, the mood and affect, considers their experiences or their perceptions, looks at their thought process and the content of the thoughts, and then it also looks at the sensorium, or the ability that they can sort information, and their cognition. So we look at level of consciousness, memory, concentration, calculation, and we look at judgment. A mental health status exam permits nurses to observe and describe the client's behavior in an objective and non-judgmental way. It is a tool that can be used to assess mental health dysfunctions and identify causes of problems. When looking at the general description, we want to make sure that we consider the overall appearance, the motor activity, behavior. The category of general description will include anything that can readily be observed about the client. To assess their physical characteristics, we want to observe each body part, noting anything that is not usual. We will describe the individual's build, the skin color, cleanliness and manner of dress, any body odors. As a nurse, we realize people that have depression may look unkempt and neglected. We also know that it is not uncommon for manic patients to dress in colorful but yet bizarre clothing and wear a lot of cosmetics and jewelry. When assessing emotional state, we consider mood and affect. Mood is defined as an individual's overall feelings. So this is subjective. It's only explained by the actual person experiencing it. Affect is the actual client's emotional display of the mood being experienced. Affect can be described as appropriate, inappropriate, pleasurable, or unpleasurable. For us as a nurse to assess the client's affect, we ask what they are feeling, and then we watch the reaction. People that have mental health problems may have a difficulty perceiving the same reality as individuals within society. An alteration in perception may have a basis in reality. These are called illusions. External stimuli are present, but the client perceives them differently, making them an illusion. A disturbance in the thought process relates to how an individual thinks, how they analyze, how they connect and organize. Disorders of thought process can include blocking, flight of ideas, loose associations, and perseveration. So thought process, we're looking at blocking, which is thoughts stop suddenly for no apparent reason. Flight of ideas would be rapid change from one thought to another related thought. Loose associations are considered as poorly organized or connected thoughts. And perseveration is repeating the same word in response to a different question. So as nurses, we understand some basic terms. A delusion is a false belief that cannot be corrected by reasoning or explanation. An obsession is a thought, action, or emotion that is not welcomed and difficult to resist. A phobia is a strong fear of a situation, a place, or an object. A preoccupation is experiences and actions that are connected to a central thought that is usually emotional in state. Amnesia is considered as the inability to remember past events, and confabulation is using untrue statement to help fill in gaps of memory loss. Memory is known as the ability to recall past events, perceptions, and experiences. We will use calculation tests to understand the ability of the individual to do simple math problems. Judgment refers to the individual's ability to evaluate the choices and then make an appropriate decision. Insight refers to the individual's understanding of the current situation.